everyone, I'm Dr. Aparna Venugopal. DocDoodles is an initiative started by me. It's a MCQ discussion, audio explanation, as well as a mentorship WhatsApp group for foreign medical graduate students who are preparing for foreign medical graduate examination. February 5th marks a very special day. It's 1 year anniversary of DocDoodles group. Also today, I'm truly happy to have with me some of the FMG achievers from my group DocDoodles. So, welcome everyone for this interview. So, let's start. First, Anisha, please introduce yourself.
I'm Anisha, and I just passed my FMG Jan 17th exam, and I got score of 222. And a huge credit for that goes to Aparna Di. I was joined in her group by a friend of mine who was there. When I was in Ukraine last year, she joined me in her group. Since then, I have been following her, and she used to post daily custom codes for MCQs, and also some of the MCQs she used to post and we have to answer it, and if we make mistake there, she also used to send audio explanation individually to everyone, like no matter if she has replied to someone before, but she will again send the audio for that MCQ particularly for you, so it's great.
So, Anisha, like basically, how did you prepare individually or by any coaching?
I prepared individually. I was I started my preparation from Ukraine. I was doing main videos of the subjects from there. Then, after coming to India, I started doing rapid revision videos and also do MCQs daily.
Okay.
That
And when did you like started doing the PYQs? During which phase of?
I was doing PYQs after I completed first read, that is after watching all the RR videos of all the subjects, then I started doing PYQs. And but I was doing the custom modules daily even before I
Okay.
started PYQs, which you used to post in the group, like the codes I used to
Okay.
follow from day one.
So you were doing both FMG and NEET PG PYQs from 2020.
Yes,
Okay, and
both.
you were like supplementing those PYQs to your RR notes, right? Whatever you are
Yes,
gaining new.
the point. Yes, the new information I used to add it to the notes, and
Okay.
the some of the audios and images from your group I used to send to it my chat, so I
Okay.
used to review them. I have listened to your micro audios, the clip
Okay.
whole micro two times.
Nice. It was consolidating all the culture medias
Yes.
of biology, parasite. Nice. Okay.
Exactly. I found it very nice. I send it to all of my friends. Like I told them, even if you are doing anything you are doing it from, you just listen
Mhm.
to this 30, 40 minutes audio clip and you will have all micro covered. It was that good.
Okay. Thank you, Anisha. I will get back to you. Next, Anshika, you can hear me, right?
Hello, my name is Dr. Anshika Chaube. I have scored 174 in recent Jan FMG. And talking about dog doodles, like it is very, this group is very close to my heart. Aparna Di is very nice senior to me. She studied from my country, and I texted her like how she approached, how she passed FMG, and then after that, she added me to this group in the final year itself. And to be very honest, in the initial days of my preparation, I was very much depressed, and I was not able to approach anything, any subject. And I'll tell you, any junior, knowledge doesn't matter. Like you have knowledge. Every one of us have knowledge, but we don't know how to apply it, how to consolidate it. That's what this group taught me. And moreover, whenever I used to give GTs, after every GT, I used to contact Dee, and then she used to tell like where, in what areas I could rectify. And with time, I guess, following the group, my scores improved, and with time, my confidence improved, and the rest is history.
Okay, thank you so much, Anshika. So, how many revisions you would have done?
I was following cerebellum. I was a prepladder user before, but I don't know how to make a schedule properly. So I needed a good timetable, and I just wanted some classes to just tell me what to do, and I'll study. So from
Okay, okay.
prepladder, I switched to cerebellum after coming here, and they themselves, do three revisions. But after
Okay.
the first read itself, they gave a pretty decent holidays. In those holidays,
Okay.
in first revision was completed with the class itself. After the class, the same ritual I used to follow. The second revision was followed in the holidays, the 10 or 15 days holidays they gave me.
Okay.
So, and third revision I did in the month of December, which was in the lab 2. And fourth revision was lab 3, the marathon classes.
Okay.
That I did.
Okay.
And
So you revised along with the schedule.
yeah, I revised along with the schedule, but what I
Good.
think is you should, focus more on the MCQs, which usually people
Yes,
are not
correct.
doing.
Hmm.
I feel myself very lucky that I am a student of Ukraine and they had Croc there. So I
Ah.
guess not only me, we the students of Ukraine have already the practice of having MCQs.
Yes.
And one more thing, people all were, very stressed about the lengthy answers and the lengthy questions and everything. And as Dr. Emmer said, we should always look for the buzzwords, and we always
Correct.
have a habit of finding out the buzzwords from the croc itself.
Mhm.
So I just use that knowledge in the FMG also. If you think, that's what I'm saying, we all know, we all are doctors, we have studied enough for 6 years. You should just know how to approach it. When I was totally confused, like when I was not scoring good, I just thought one thing, just approach the questions as you approached croc. You scored very good rank in like very good marks in croc. Like there it is 65%, right? Here it is just 50%. I motivated this way myself. And then in the same manner, I just did PYQs repeatedly. First I started with FMGs, and then I did in this third revision I did need PG also. And at the end I did MCQs of only 2025 of INICT. And
Ah,
this
good. I like
fund,
this.
yeah, only final year, only 2025. And
Okay.
funda is same. Just repeat the same things and repeat the questions, the PYQs, and definitely even the hardest things, you will definitely know. There is nothing hard or simple
Yes.
in medical, I guess. You just read it 10 times and it becomes easy. If you don't read it, it is hard. That's all.
Yeah, that's what, like, doing MCQs is actually the game changer,
Yeah,
because
seriously.
we can revise the notes, but we have to know na, like, whether we are able to apply that concepts that we know by revising the notes multiple times to MCQs. So that's why, like, by practicing MCQs only, we will like develop these how to identify the buzzwords and how to rule out options. Because in FMG also, the thing is, like, we have like 300 questions in FMG, so they will be like so many questions that out of the world. So for that also, how to approach them is like by ruling out option, because some options we can rule out.
Yes,
So the idea of ruling out and everything will we will be able to know by doing so many MCQs. And also, like, by doing MCQs is also a part of learning, so we will come
definitely,
across new questions and we
definitely.
can add that.
I will. I have said this so many times, and I'll ready to repeat 100 times. Like you have put some at the last 10 days or 15 days or something when you started giving those 20th notebook wala stuffs, everything and all. Two questions. One is endometrial cancer ka image. Add as it is. The image was asked in the exam, and nucleuzumab. See, I never knew that paroxysmal usme nucleuzumab dete hain something. You told me. You
Ah.
corrected me. Your voice note that was running in my mind. When I saw that question, I was happy. Oh, Dee told this question, and
Ah,
I just
I
immediately,
remember you texted me after
yeah.
exam that it was ma'am.
Yeah. So,
Yeah.
moreover, this group helped me in my last revision because mostly when the exam approaches, we all are so exhausted and nothing feels like you should study or we should give up. So, I just simply used to learn, like, listen your voice note. And sometimes you
Mm.
used to, personally text me that this you made wrong. It is very important. Make sure you write it. So, I added those
Ah.
stuffs in my 20th notebook. My 20th notebook was my GT book itself. I personally felt that all my mistakes are in one place. Although I got little problems, as you said, in revising that, but I didn't used to revise or do any kind of active recall to my GT book. But at least I used to see once, like where I'm lagging, which areas I'm doing repeated mistake. I used to
Good.
see once.
And like whatever like topic that you find difficult, you can do that topic from the question bank, right? The way
Yeah.
you told.
Yeah, I
Main question.
approached main question bank this way only. Like what I didn't do the main quiz bank. I mostly approached
Mm.
PYQs, but personally my glaucoma topic and schizophrenia topic was
Uh,
weak. So I just approached main Q bank for that particular topics, which I was doing repeated mistakes.
Good. Okay. Yes, Anshika, I will come back to you now. Next,
Thank you, Anisha.
Soumya. Soumya, can you hear me?
Hello, ma'am. So my name is Soumya Jaiswal, and I graduated from VNMU, Ukraine, and I cleared my recent FMG with marks of 184. And I'm very thankful to Dr. Aparna, ma'am. And I joined the group in like August or September, and
Mm.
this group has been like breakthrough point for me, like all the voice notes and all the images that she used to post in this group was very helpful for me. And like pictorial memory is very important for doctors, right? So this group was like that only. And particularly the all the images that you posted in last 1 week or 10 days, that has
Mm.
been like a breakthrough point for me, because some of the questions, as the students have already told, like endometrial cancer and adenomyosis eculizumab and also Ionism, question
Oh.
came directly. So it was like
Mm.
twisted, but it came like that only.
Mm.
And the way of explanation that you put it in the group, and the effort that you made, like reaching out to students, that is like the students approach the mentor, but when the mentor approaches the student, that is like very unique thing. And
Mm.
so I started my preparation since the college days only, and my primary source was prep ladder. And
Mm.
but for short subjects like psychiatry, anesthesia, radio, and orthopedics, I used cerebellum. And most of the grand test that I gave was of cerebellum only, but few mock tests I also attended of marrow and also of prep ladder. And all the clinical subjects I did from prep ladder, like medicine, surgery, pediatrics, and also like obs gynae. And also I did my revision like 4 to 5 times in my in last 6 months. And yes.
I just want to ask you one unique question actually. How
Sure.
real FMG exam and the GTs that you did are like different? Actually, it will be different, right? So
Yeah, of course.
how much difference you felt?
The first thing is that, like in grand test or mock test, the environment that we give, the most important factor is the environment. Like at home, we give most of the GTs at home or in like centers. Like some attend like CBT computer-based test in the centers also.
Mm.
But in the real FMG exam, like the anxiety happens, and
Yes, yes.
seeing the lots of students, like everything happens, and we have to be mentally prepared for that by giving more and more mocks and GTs, grand tests.
Yes.
And the level of the questions are like in the real FMG, the level of questions is at above the some questions are above the mocks and GTs, but some
Mm.
questions are PYQ only. And we know that like it tests the analytical thinking, clinical reasoning, and approach to the clinical based scenarios and how to manage the patient. So we have to be prepared for that. Even if it is a screening
Yes.
exam, we have to be prepared for that by giving more and more custom modules and
Mm.
tests and mini tests and all the mock tests. And the
Yes.
real thing is that the main difference is like the scenarios and the clinical settings, like the
Mm.
difference in the environment factors. And the most important thing to attend the main exam, like main the the D-Day exam, like is that we have to be very positive mindset. Positive mindset is the most important factor. Even if you have revised 1 to 2 times, it doesn't matter. Even if you had not studied, it doesn't matter. You have to be very positive in your approach, because whatever you have studied in your last 6 years in Ukraine or any other country, a foreign country, it will be fitted in your subconscious mind. So you have to just brush it up, and you have to revise all the concepts in the last 6 months or 4 to 5 months, and you will be good to go to give the exam and pass it.
Yeah, that's what like when the new students know they when they will do PYQs, of
Yeah.
this exam also, they will feel like it's very easy because it's
Yeah.
recalled questions, no?
Yeah.
But the
Yeah.
actual exam question is completely different.
Yeah.
So I
Most.
remember
Yeah,
ki when I was
most of the
mm,
recalls are created by the students only. So
yes.
the student tell whatever question came in the exam, but the student had solved 300 questions. So they also tell some questions which are wrong, like options. They tell option and option is feeded by the teachers in their question only. But it's not like
Yeah.
that. It's some questions are I agree that some questions are one-liners, but most of the questions are clinical based scenarios. So whatever
Yes.
we get analyzed in a mind that this question came and this answer is that. So
Mm.
that question is feeded by the teachers. So it is a
Yeah.
very different that you don't have to solve only PYQ. PYQ is the base, it is the foundation. We know that
Just to know
pyramid.
the
Yeah,
previous year
yeah.
topics.
Yeah, pyramid.
Yeah.
We have to reach to the apex of the pyramid. So
Yes, yes.
you have to make your foundation very strong by solving the PYQ. Direct PYQ will not come. It will be twisted in some or the other way. So you have to
And
solve
also,
more and more questions.
yeah, and also that there plays the role of GTs, because when we
Yeah,
will be doing GTs, and also I
yeah,
tell like GTs we have to do in the same time of exam, like sit
yeah,
at
yeah. Of course.
9:30 itself and the break, everything just as
Yeah,
the
yeah.
exam day. So in
Mhm.
that way only we will like I mean get the real exam stimulation, because in FMG exam we have first 150 question and after that a break and again paper two. So fatigue hits in. So for
Yeah, yeah,
that, our brain should already be prepared. So
yeah, yeah. Of course,
by
I
doing
agree.
so many GTs only, we will like able to
Yeah,
sit
yeah.
for the exam.
Yeah, yeah.
Yeah.
And you have to give like in last month, all the major platforms conduct their All India mock test. So
Mm.
we must attend all the All India mock tests from
Yes,
every
yes,
other leading platforms.
yes,
That is very
true.
helpful in managing the time and also the questions. The way the language, we have to understand the language of the questions. It is not the it is not like the easy or difficult or moderate question, but we have to understand the even one-liners we get wrong. Even I did some questions wrong. We were like one-liners only, but we have to like get the language of the question.
Yes, true. So, actually, how about the daily custom modules that I post in the group, which include the 19 subjects? That I always tell like it's mandatory that everyone should
Yeah,
do every day to be oriented
yeah,
with all the 19 subjects. So,
yeah, yeah.
how you used to approach that?
Yeah, at whatever time you used to post the MCQs, I solved like after 30 minutes or 1 hour, I used to solve that custom module
Mhm.
and from the beginning till the end. And I used to solve the other custom modules also from the cerebellum also. And
Okay.
by using the tags like NEET PG and FMG and INI also. And
Mm-hmm. Good.
also it's like
Clinical.
clinicals and image based, yes, and
Mhm.
instruments also. So the
Okay.
main thing is we have to analyze, like this is analytical thinking. So we have to analyze by solving more
Mhm.
and more questions. Even if you don't know the answer, whatever the gut feeling, like whatever we are feel that this is
Ah,
correct,
yes, first
we have to
instinct.
click that option. It's not
Yes,
easy
yes.
to click one option. We have to change. I also change some of the options, but avoid changing the options in the main exam.
Yes, and you used to listen. I mean, if you are not getting time to answer the questions that I am posting in the group, you used to
Yeah.
listen the audio explanation, or you used to just see the MCQ and audio explanation together when you are getting time or at bedtime.
Yes, I used to, whatever questions I did wrong, you used to tag and explain that in
Yes.
the audio format. So I used to listen, not in 1x, like I used to listen in 1.5 or 2x. And like, yes. And also I used to note it some, I didn't make the 20th notebook. I made some flashcards of every
Ah, good, good.
clinical subjects. So in that I used to annotate. And one flashcard I made of randomly, like every important thing I wrote that. And yes, and whatever stuffs you posted in last 10 days, I used to like note it down. And some questions came from that also.
Okay. Yeah, the
Yeah,
last 30 days when we
yeah,
had NEET PG
yeah, yeah,
PYT
yeah.
discussion.
Particularly of PSM and microbiology and
Okay.
anatomy also. Yeah,
Oh, anatomy also.
yeah, yeah. Some questions like in the clinical, like in integrated manner.
Ah, integrated man. Ah, because
Yeah, yeah,
FMG is now all about integration only.
yeah,
Next, we'll come back to you, Soumya. Yes.
My name is Anumita. So yeah, it's been a, like this group was a place where I used to get, whenever like my journey was kind of, I got very less time to study because of my health reasons and many other things. But like, I think the whole point where a person does, great in such exams is their ability to, get that instinct right for the questions, which, like, I think most of us, even after studying, we feel like we are doing a guessing game there, solving the questions. Like sometimes we feel that even after studying, but I think it's the instinct that develops only after, like, it is which we don't understand, we ourselves are developing. I think I understood this after I don't know, like even I was not confident about myself, but the I should appreciate you, Didi, for giving the audio explanations for everything and taking time to even correct everyone. I think I was like, how is she even doing that? Like, it is actually very, very, like, I think it's the best thing that you're doing. Like, it even motivates the student to, keep going. And yeah, and the 20th book contents which you gave, like, you put the important images and all. I actually remembered you during when I saw that bladder carcinoma picture. I remember, like, I was like, I saw this somewhere. Okay, I saw it in that group. I was thinking like that. That's true. Actually, um, I think most of the people, they become like the journey gets monotonous, and I think like it's so kind of you to do this because it pushes the student to keep moving, and even gives them the important things, like if any student doesn't know for that, like what to focus on, uh, it's a best place to see what are the important things, even if like they are at least seeing it for one time if they are not seeing it by themselves. So yeah, the whole point
So,
of it is very useful like that.
so is there was any moment that you felt like giving up, and then how you pushed yourself through? Because I think personally, like, you are the best person to answer this.
I don't know, even before the exam day, I felt like I won't do this time because I did not know. Like, I was not confident about myself, to be honest. Like,
Because I
when
remember we had a talk in phone when you were like feeling so down. So you told me like I won't apply for this exam. I will apply for the next
because
attempt, and I told
true,
you to
true.
do it.
Yeah, that's true. That's what I'm saying. Like, even like, beat anyone in my place. I think what you're doing is something which will push the student to, think like, okay, maybe I'll give it a try, or I'll keep moving. Somebody is helping me. So that's the whole point of it, and it's definitely the best thing which you're doing.
And also, Animita, how did the last 30-day plan and NEET PG PYT discussion of 2025 paper helped you?
Full in the way where I even spoke to you regarding this. Like, I observed kind of the topics being repeated in the, like, those asked in INI being asked in FMG again. I had observed this and I had asked you regarding this as well. So that's what I thought, like, these topics might, appear in our exam as well, because that's what I saw. What was asked in the previous I&I was somewhere or the other was even asked in the FMG as well. I even sent you the screenshots showing you, like, I'm feeling this. So maybe you were like, yeah, that's why I'm doing the 30-day plan, because you might find those in your exam as well. That's what I think. It is helpful doing this thing even for the future aspirants as well, where if they focus on the topics that are being tested in all the other exams, it's not the same thing that's asked, but somewhere revolving around that itself.
It's true, because at the end, NEET PG and FMG is conducted by the same board, right? NB. So if they can just stick on to the same previous year, same topic that they asked for NEET PG, they can stick on to the same topic but different question. So if we are prepared for that topic, then like we can answer that question also. So because we are already prepared, they will be just framing a different question from that topic itself. So at least, yes, as you told, it will be helping out ruling out the options also. So that's why it's important to do both NEET PG and FMG previous year question from 2020, because we have to master that previous year topics. It's not about PYQs, right? It's all about previous year topics. Also, there will be some days, right, that we will not be feeling to study because of the anxiety about the results and all. So those days, how you will be trying to make little bit productive?
I think like the topics which are being asked every time, like I thought maybe I should keep solving something from that. In Marrow, there's a thing called as in your calendar, it shows how many modules you've done each day. Like it doesn't apply for
Yes,
the
yes.
modules, but it's for the Q bank modules. So what I did was I only selectively solved the topics which are being tested, like, every time. Some topics came, some did not. Like vaccines are such a topic, like for example, vaccine, they're asked every time. So I thought
Yes.
there might be a question. There was not. Like this paper was kind of unpredictable. Like there were topics which were tested previously, like tested heavily, but they did not ask it. So those kind of topics I tried solving even when could not study. I was like, just solve some Q banks just like that. Like even not with full focus, but at least to just make something go through, in my, like I should just have a vision of them once, like that. Like that was the least I was doing.
That's what, even if we are not feeling to study some days, it's better like do so many questions at least so study, or just passively see MCQ discussion videos which are freely available in YouTube. So that also we can passively just listen the discussions, or you can just see our group, just listen to that audio explanation. Okay, then Anumita,
Okay.
Amar, can you hear me?
Myself, Amar, like I cleared my FMG in last year, July. Now, I'm from Kerala. I just started my internship 2 months ago in Maharashtra. It's pretty good here, and I'm not that connected with the group now because the internship started like 2 months before. But still, I know the phase in which I was preparing. Like I was like from the starting onwards, I was there in the group. Like I think almost by February last year, like this group started. So
Yes.
from the initial stage itself, I was there in the group, and it was like pretty much good in the preparation phase. Like I took one offline coaching. After that, like I started to prepare in home itself. So like that lonely feeling was not there because of the group. Because Didi used to put the questions everything daily, and the voice notes also helped us a lot. Like I used to star some voices of her so that like I can repeatedly listen it before the exam. So like just 1 month before, like that, and many key points and mnemonics were there, and like it was pretty good. The group helped me a lot to clear, because like it's a little bit tough to prepare alone when we are sitting in home. So all of us will be connected if we have a group or something like that.
Yes, because lots of anxiety will be there if we are
Yeah.
preparing. So I also prepared FMG myself only. So if we are in home and then we have to make our own timetable and we have to
Yeah,
like be
correct.
so consistent, because if we are preparing ourselves, we are the teacher and student, because we have to
Student, yeah,
put
correct.
custom modules and test ourselves. We have
Yes,
to do
yes.
everything. So we will be the one who will be pushing ourselves.
Putting yourself,
So
correct.
yeah, so very nice. So how many like GTs and how you evaluated the GTs and revised it?
Like in the initial stage, I used to give like in 1 month just one GT, but like in the last 2 months, I used to give like two GTs like in 15 days, like that. That too
Okay.
mainly the custom modules which we used to get in the group, like the
Uh-huh.
codes, and like I also had Prepladder subscription, so I used to do the GTs from Prepladder also, and
Okay.
all the GTs which were like available for free, like from Cerebellum, everything.
Marrow
Yeah,
and all.
but yeah, Marrow, everything. Yeah,
So almost you must have done it at least 5 GTs, right?
yeah, more than 5. Yeah.
And how you evaluated same day when you will be doing GT, you used to evaluate, right?
Yeah, like some of the answers we used to get after 2 days or like one day. So
Yes, like
some
GT.
like some apps are like that. So if I'm like little bit stressed that day, I won't I'll
Good.
just leave the GT and just keep it aside and do some subjects. Otherwise, like I'll do the evaluation next day.
And you will be like adding the new information to your that particular subject textbook itself,
Yeah, yeah,
not
correct.
maintaining a subject. Okay. So that's what I used to tell everyone also, like it's better because even I used to maintain a separate book of GT, but it used to be like a burden to me at the end because we don't have enough time to revise that also. So it's better to, I mean, write it whatever new information that we are coming across in GT to that particular subject textbook
Correct.
itself. So when we will be revising, we can revise that also and connect also. Yes. So how did like that no, because our group is non-poll based MCQs, right? So how
Mm.
did non-poll based MCQs help you compared to the regular Telegram or WhatsApp groups?
Because like in the poll based MCQs, like people usually don't think that much. Like if we have that poll now, so people who used to vote for the most like MCQs, they used to vote again. So we don't
Yes,
have a
yes.
clear. People will not think that much. But after that, in the initial stage, it was like that.
Yes, it's true. I used to post poll-based MCQs at the initial stage. Then I understood like it's not that much beneficial because if one person attempt that MCQ, then the very next person, whoever is attempting it, they will be seeing the answer directly, right? So it won't be that much beneficial. Then I understood like it's better to post MCQs as text-based so that you can just slide it and reply the option that you feel will be the correct answer. Then I will check and I will give individual voice explanation to the wrong ones.
But after
Mm-hmm.
that, like we changed it to
Yes,
the
yes.
just options or like that. After
Yeah,
that, like it helped us to think.
yes, yes. So, what about long stem MCQs? How to approach according to you?
Like I don't like really find the buzzwords which are like there in that, because like
Uh-huh.
it's like a lot of time consuming, like in my opinion. So in the exam also I used to find the buzzwords, or like at the I used to read the last stem of the question, because
Okay.
um, because mostly like the main information will be there only.
Yes,
Others
yes.
will be like simply stories like are made up.
Or it's like better to read the last line, and if there is an
Last
image
line.
that, and just see the
Yeah,
options
correct.
and like come across answers. So to confirm, we will should read the whole question.
Yeah, correct only. Because in the July exam, like the questions were like pretty much very much lengthy.
Yes, yes.
It was
This
very
exam
much.
also, Jan.
uh,
Hmm. Okay, okay. Next, I will come back to you, Amar. Next, Amit. Uh, can you hear me?
Yeah, I hear you.
Yeah.
Hello, I'm Amit Kumar. I passed Jan 17th, 2026, and I scored 177. And I'm
Yes.
very thankful to Aparna ma'am, who because I'm connected to DocDoodles, and it is very helpful for us. Likely, she's always appreciate us, and during after the GT, and during during the after MCQ audio, and a lot of trick to how to remember this tricky things,
Yes. Yes.
like
Yeah. Basically,
calcification like that.
yeah. Basically, when did you joined DocDoodles, during which phase of your preparation?
Starting my preparation fifth year, but
Okay.
due to some reasons and health problem, I didn't study
Okay.
in the sixth year.
Okay.
So just
Yeah.
I joined some FMG coachings offline, and
Okay. And
I
you
scored only this.
okay. How you like use this group for MCQs? You would supplement it to your main notes?
No, actually, I'm using this group like many things. I read a lot of things now, so it
Hmm.
is very confusing that all are mix and like that. So
Uh-huh.
I just use that to how to remember these things, how
Okay.
to use of tricks like that, and
Uh-huh.
it's also give a stimulation when some all are giving answers in group and like that. So it is a stimulation like that, finally.
And what about MCQs? Like, did you do main Q bank or did you just do the custom modules and tested yourself?
I do custom module, and when I start solving PYQ now, so then I thought that I already solved all PYQs, because in custom module there is all PYQ are there. PYQs are
Okay.
done,
Mhm.
and some PG questions are also done. So
Okay.
just for revision,
And like, which
simply.
all hashtags you used to put for custom module?
Need
Neat.
NEET PG, clinical, and FMGA, and sometimes and
Image based.
ICT.
Okay,
Image
so
based.
that's what, like, when if we do main Q bank, then it will be like a burden because there are so much sections to get completed. But if we do custom modules with these hashtags, we can like test
हाँ
also, like after every
हाँ
subject after we prepare, and if we do a custom module of that particular subject, then we can test ourselves like where we are forgetting
हाँ
or what, if there are new information we can add that also to our
हाँ
notebook, I mean notes.
हम्म,
So when we will revise that again. Yeah,
हाँ
so
yeah.
okay, then I will come back to you. So next,
Okay.
Dheeraj, can you hear me?
My name is
Yes.
Manidhiraj, and I have completed my MBBS from Zaporizhzhia State University from the 4th year Ukraine, and got transferred to Uzbekistan, to Bukhara State Medical University for 2 years, and I completed my graduation on 2024, and I cleared my FMGE in third attempt, with 154 marks. At in first attempt I got about 140, and second attempt it's 145, and it's very heartbreaking. 148 second time is, I'm sorry, it's 148. I missed by 2 marks, but I broke hearted and I did not give up. I rose back again, and I cleared my FMG in my third attempt in 17th January 2026. And DocDoodles has helped me a lot. Lot of every day in the night before going to bed I used to listen and go through, as already everyone has said. And some of the questions, as before you have said with a discussion with Anumita, that your audio used to come in my mind as well. Some of the internal medicine bits, some of the gynecology bits, those image questions and everything, while I'm solving them. Exact images, I did not expect that the group images will come exactly in the main exam. And yeah, that's it. And my family are everyone are very happy, and even for the first time I can see happy tears in my parents' eyes, and it's priceless for me. It's a priceless reaction for me. Being the only son,
True. Parents are our biggest support system at any phase
yeah,
of our life.
being the only son,
We,
it feels very special for me.
yes.
Brothers and family.
So you are a barrier to every one of us and an inspiration also, like the good example that we can like tell anyone, a person who didn't give up at any even after getting 148, 145, still you didn't give up and you fought till the end until you
Yeah, yeah,
got the desired result. So
yes,
it's
yes.
really great.
That I have prepared and I have cracked with the self preparation. Those who are doing self preparation, do not think that only the coaching, online coaching as well as offline coaching helps. If your material or if your concepts are good, you can, however the tough the paper may be, you can easily crack the exam as well. That's the I want to tell. One of the lesson, one of the
And
small tip I want to give.
during your self preparation, how did you evaluate? Like after completing one subject, how did you evaluate and gain confidence that you know everything about that subject? How did you evaluate yourself? Is it by doing custom modules or by mini test and all?
After completing every subject, I used to see the revision videos of Preparator in the YouTube. In the group also, you have posted many rapid revision videos as well of the Neha Taneja madam for the PSM,
Yes,
Marwa sirs of Marwa sirs internal medicine. I used to save those all the playlists, and I used to revise them. After my main notes only, I used to revise them, and also after that, I used to see. Do not want to advertise, but I want to tell that DAMS, DFX, and AFMG QRP programs have helped me a lot. About 50 to 70 bits I have got correct because of those last minute revision. After every subject, this is my schedule: the main videos, the revision video in the YouTube, and the third is DAMS DFX video, and reading that DAMS DFX video notes as well. And after doing everything, I used to go to the custom modules and grant tests and the previous year's papers. I used to collect everything, and you used to tell me in the group, in all your interviews or everything, if you got any mistake in any mistaken bits, you should write that concept way in the main notes as well. That's the main thing I have done.
Yes,
Main thing I take some efforts. It takes some time, but those efforts
yes,
matters in the final days, and it has
mm,
helped me a lot, and helped me in retaining more knowledge compared to previous attempts.
Yes, otherwise, if we maintain a separate book, then we won't get time to revise that also. So it's better to always, when we see new information that we will get from MCQ discussions or when we practice custom modules and all, it's better to add all to that particular subject textbook so that we can revise it later on together when we revise that subject.
Yeah, I am telling that I don't. It might work to another people or not. I don't know. I did not maintain the mistake notebook. I only noted those mistakes in the main notes as well. I did not have any 20th notebook or mistakes notebook. I only use the main notes, those custom modules. I used to review everything. Mostly, I used to study about. It may be exaggerating, but I used to study 11 to 12 hours per day. Most
it's
are
needed
you
actually.
yeah, yeah, I
It's
used
for
to devise
exam.
these slots. Yeah. Initially it's very difficult from getting detached from the social media and connecting into the FMG preparation, but I use the Japanese technique of increasing day by day, 1% increase, 1% increase day by day, and I increased from 2 hours to 4 hours slot, and it gradually helped me a lot.
Yes, we should be consistent because when we are, especially when if we are doing self study, we should be consistent because we are the person who is monitoring us. So it's very difficult to start studying 10 hours, but start with 8 hours, then gradually increase the number of hours to 10 and then 12. But we should be very much consistent because at the end, if we are doing self study, as I told, we are the teacher and we are the student. Okay, then thank you, Dheeraj. Next, Soumya, can you hear me?
Yes, ma'am.
Okay, Soumya, how did the integrated way of studying helped you? As I discussed always in the group that it's better to study patho, pharma, medicine together so that we will enjoy learning more. So how did you do it?
For me, the integrated way of learning was particularly of solving MCQs of the subject like patho, pharma, medicine, and so it helps to like cover the wide spectrum of topics. Like in pharma, if we revised cardiovascular system, and in medicine we studied about the cardiovascular system, that is very major chunk of the medicine lies in the cardiovascular system only. And from patho we get all the stainings and all the histopathological examination and all the images. And so the integrated way of learning worked for me. And the way you told that these three subjects have to be clustered together and have to be revised together, that has been also very beneficial for me, particularly of thinking as a way of clinician, of diagnosis and then the further treatment and all. So it was very helpful.
True, because if we integrate these three subjects together and study, we will not get bored. Otherwise, studying pharma continuously for 5 days, like burnout will happen. But if we study in this way, we will enjoy more. We won't feel bored. So, studying system wise, like cardiology, all the three subjects together, patho, pharma, medicine and then respiratory. So thanks to Zainab ma'am, actually, it's her technique and it's really beneficial for exams. Next, Anisha, can you hear me?
Yes.
Yes. Anisha, which subject MCQ discussion helped you the most from our group?
I guess the last 20 days, when you started the integrated questions of pharma, along with you discuss all the PYD topics around that it helped a lot because pharma was one subject which I found difficult. But after the discussion from the group, I gained that confidence. Okay, it's doable for me and I'll be able to solve the questions. It gave me the boost I needed at that time to do pharma. Other subjects also have
Okay.
helped a lot, but in particular, that was really a game changer for me.
Also, what will be your advice to the future FMG aspirants?
You are in university right now, start early, build your concept strong, do the main videos, but and then after coming to India, rely on revision videos because it's not possible to do entire subject. Revision videos and start practicing MCQs early. Like initially, I was also very hesitant to start the MCQs, but then one of my friends said, "You will never be ready enough that you will not feel confident enough to start MCQs. But anyhow, you have to just start and make a habit." Yes, practicing MCQs and giving GTs. It's both equally important.
Yes, yes.
So first aid you should start. And also like doing custom of all 19 subjects is important. You will be oriented to because when you start a new subject you tend to forget what you studied earlier, but when you solve the custom of mixed bag custom like all subjects, you still get in touch with that subject. And especially the last 20 days, when you gave a plan, okay, like you have to start this way, you are lost in the last few days. You don't really know, like
That's
so many things are going on, like what to do, what not to do. So when someone gives you a plan, you feel like you get a direction. Okay, like it's doable. You think, okay, it's manageable, it's doable. So it will give you that direction to move forward.
Yes, that's what. Because in the last 30 days, like we will be like totally blank because of anxiety about the results, what will happen in the exam day. So that's why I thought like I will come up with a plan. So if we are having a plan, we will be very much consistent and we will like do more according to the plan for the last 30 days. So that's why also after so many inputs this time I came up with a timetable for the students so that they have a timetable now, those who are preparing themselves, so they will be consistent. If someone is giving a timetable, they will be consistent and they just have to follow the timetable blindly, and they just have to study from their own sources and just do MCQs. So according to timetable they will move and will study from the sources that they are comfortable with.
Very helpful, whatever you are doing. And I'll recommend all my juniors. I have already recommended so many of my friends your group, and just to follow you.
Thank you, thank you
Thank
so much. Now, Anshika, so
Yes, the
yes, so what one mistake that FMG aspirants should avoid doing?
avoiding tests. Mostly,
Mhm.
like lack of confidence, people avoid tests. But I would like to emphasis on that you
Yes.
should actually give the test, even if you score like 1 or 2 marks in the test, because it has happened with me. But I had always come back like, okay, let's because I guess giving uh, like analysis is more important rather than giving the test. Okay, doesn't matter. You might score less or you might fail also. But at the end, it is just it's in your place and it's in your home. Nothing is getting added and nobody is judging you. It's just you and yourself. The battle is within you. So this is, and also I have talked to some of my friends who are repeating or who are repeaters for 2 3 times. They are very scared in giving tests and appearing for the GT. Hardly 1 or 2 tests they give before the exam. I guess this is the most common mistake every one is doing, which you should avoid.
It's very true because marks doesn't matter. Whatever we are scoring in GTs won't be the marks that we will get in the real FMG. So, and also about the custom modules, it's all adding up to the preparation. So, even the GT, the custom module, whatever you are doing in each and every single day, it's important and it's a tool. It's adding up to your preparation, right? So it's a marathon race, and we should be like trusting ourselves in each and every single phase of our preparation. And as Soumya told, during the FMG, I mean, during the real exam, whatever will be your mindset, that matters. And if your brain is very calm, and if you are right, if we are giving the exam with a positive mindset, then your brain can do wonders.
More tests and doing more MCQs will also help you in ruling out the options, because mostly none of us go in the exam hall with the 100% preparation. But if you have a very good understanding of the MCQs, and then your ruling out game becomes very strong. So sometimes what happen,
Yes.
maybe you are not familiar with the question or what the concept, but you are familiar with the options. So how I approached
Yes.
MCQs is like same as I used to approach Croc. I used to read the options first, and then I used to read the last lines first, which actually gave me the idea of the concept, what it is asked. So sometimes it is very helpful to just go approach the answer. And that will only be covered if you do the MCQs every day. And also that, to avoid that exam fatigue, you should have a habit of practicing MCQs. Like mostly I hear like either you should do 50 MCQs or 100 MCQs, but I personally I started with 300 MCQs only, because just to stimulate those three to handle those 300 questions, it was, I don't know, it is doable. So I started with 300 MCQs initially, and then it was like it raised to 500. So as at the
Oh,
end, I had a habit of doing 500 MCQs. So it was very, very much doable. I didn't had any kind of exam fatigue, or I didn't felt, the questions were lengthy or
yes.
something. It just felt like the everyday stuffs. What I did, the mistake personally, was the changing of the answers. Like, I don't know. That's what I'm saying. You should be confident enough. Despite doing so much, we still, the exam scenarios and the exam hall is very different, because somewhere when you give the MCQs and do the test and the comfort of your home, the back of the mind, you always have that thing ki, okay, chalta hai. But in the exam, you are so much conscious, and even you are not knowing one answer. Like I still remember, uh, the lambda sign was there asked, and knowing I knew the answer, but yet I made a mistake. I changed the answer, and I guess this regret I'll have for the lifelong. So this is only the overcome if you stimulate the timing and you practice more MCQs. And this is what the mistakes people are doing still. I guess they are studying, they are blindly studying. They are studying for like pretty good amount of time, but they are not able to apply it properly. And this will only overcome by doing more and more MCQs. That's it.
Okay, thank you, Anshika. Amar, can you hear me?
Hello, yeah, I can hear you. The mistake which I did, like in my MBBS days, like I was in Ukraine in Ivano-Frankivsk, so I didn't study that much, like in the initial 3 years, or like at the time of Croc only, I used to like sit and study little bit, but like it was little bit mistake, because like if our basics are strong, most of the questions are manageable. Like if our basics are strong in pharma, like patho and micro, then like medicine becomes little bit easy for us. So like it's important to build the basics from the initial dates itself, like not wait for like the FMG preparation phase. Just start like 2 years, or like 1 year prior. That will
True.
be better for
Okay.
everyone. Yeah. For the
Thank you, Amar. Thank you. Now,
okay.
Amit, yes. What will be your one honest advice to the repeaters?
Uh, trust on the journey and trust on the preparation.
Yes.
Helps a lot in during the exam.
Yes.
Means if you have if you are trusted own self, then it's give a good result. Otherwise, you'll make a lot of mistake and lot of change the options in the exam.
Mm. And if someone joins DocDoodles today, how should they use it properly for their preparation?
Solve the custom module in a same day, and try to answer actively in same day of MCQ that you posted in group.
Yes, true. Because that's what in our group also we post a custom module which include questions from all the 19 subjects from Arrow. So it's very important to do it every single day. I always tell it's mandatory that whatever happens you have to do it, because why, it keeps you oriented with all the 19 subjects every single day. So even if you like didn't do first read of all the subjects, still you have to do, is because when you will be doing the subjects the very next the coming days, you will like at least remember this topic I did as a question in custom module. So that connection also matters, it's very much important. And also at least like when you will be doing 19 subjects MCQs through the custom modules, you will just go back when you will be evaluating. You will be go back to that subject, or you will at least see the textbook while you will be evaluating. So in that way a little bit revision is also done, and it will keep you oriented with the 19 subject every single day. At least you will be doing something or other with the 19 subjects every day. Also, if any of you watching this video want to join DocDoodles group, text me on Instagram at apb_99. I will provide you here and I will share you the group link there. Okay, so that's it. That brings us to the end of today's session. Thank you so much for finding out time and sharing your honest journey and valuable tips for the students who are going to write upcoming FMG exam. And I hope I can continue to do more, create time and bring FMGs together under one community, DocDoodles, to help to make dreams come true. And again, thank you so much and God bless you all.
Didi, for your
Thank
help.
you.
Thank you,
Important.
Dee.